Hello everyone, my name is Irene Ishan and this presentation is on hypertension, its risk factors and management. So the goals of this presentation is to educate the young adult to identify risk factors for hypertension, identify health issues associated with hypertension, and also to educate young adults on ways to manage and prevent comorbidities associated with hypertension. Hypertension in all can be defined as blood pressure which is higher than normal. And for this to occur, it means that the force of the blood pressure pushing against the blood vessels are consistently high. So here we see categories of blood pressure. We know a normal blood pressure is supposed to be the systolic blood pressure, which is the first number that comes up, should be less than 120, and the diastolic should be less than 180. So we classify a blood pressure to be elevated if it is between 120 to 129 with the systolic, and the diastolic is less than 80. Higher blood pressure hypertension is between 130 to 139, or the diastolic blood pressure is between 80 to 89. So with the hypertension stage 2 is either 140 or higher with or a diastolic blood pressure of 90 or higher. And when a person is in hypertensive crisis, that means the systolic blood pressure is higher than 180 or the diastolic blood pressure is higher than 120. So we have several risk factors for hypertension, and these risk factors are usually classified or grouped into two: the modifiable risk factors and the non-modifiable risk factors, which we're going to talk about it more on the next slides. With the non-modifiable risk factors, these are the risk factors that a person cannot be changed or adjusted in any way. The first one we know is age. A person's age keeps on going higher, or not everybody keep increasing in age and it doesn't decrease. With genetics cannot be modified in any way. With any way in sex, it's either you're a female or you're a male. Now we have other genders too, but male or female sex cannot be modified in any way. And we have ethnicity, that can also be the race or the culture the person comes from. With age, we know high blood pressure is more prominent with people as they increase in age, because they have factors like hyperlipidemia or those ones that can cause the person to have high blood pressure. With genetics, some people are predisposed to high blood pressure or other disease conditions as compared to other people. And with sex, high sex gender like females, the female gender is more prone to getting high blood pressure than the male gender. And with genetics, we know high blood pressure is very common in the black American race as compared to the Caucasians or other races too. With the non-modifiable risk factors, so modifiable risk factors include alcohol use, smoking, excessive dietary salt, overweight and obesity, diabetes, and stress. So when it comes with the alcohol use, it is known that drinking too much alcohol can raise your blood pressure, has an effect on the blood pressure, so it causes the blood pressure to be high. And smoking And smoking just one cigarette can produce an immediate or temporal like 5 to 10 mHg rise in your blood pressure. And even though the effect is no long term, continued use of tobacco or any tobacco product keep wearing your arteries out, which is not good. So excessive dietary intake, taking a lot of uh, canned foods or cured meat, already prepared meals like pizza, and adding table salt to your food also causes high blood pressure and hypertension. So it is advised that you do not add any table salt to your meal, and you should limit the amount of cured meat and canned products you eat. Overweight and obesity. So overweight and obesity, it kind of have like is just having a sedentary lifestyle. You have to exercise. Limited exercise causes your blood buildup of cholesterol in your blood vessels, which tends to thicken up your blood vessels and causes pressure in your blood vessels. So it is advised that is that important that you maintain an adequate weight, and you should just exercise to stay healthy. And diabetes also predispose you for having blood pressure and stress. So stress causes a whole lot of buildup in the brain, and stress also increases one's risk factors of getting hypertension. So managing hypertension includes practicing a healthy diet, which includes eating less salt, low fat, low sodium diet, and eating more vegetables. It's important to incorporate the my plate portion in your meal. You eat adequate amount of lean meat, you eat more vegetables and more plant-based proteins, which is good for your health, and have healthy meals like nuts and eating and all that helps to reduce your risk of hypertension. Getting regular exercise and being active. At least if you work like 30 minutes or having like 30 minutes exercise during the day, or an hour walk in your neighborhood, like stress walking, it helps burn out excess calories and burn out excess fat too. And it will help you build lean muscles and get rid of fat too. So maintaining a healthy weight. So with the BMI, it's important that you stay within the normal BMI for your age. So you shouldn't go overweight or below weight. So being overweight also increases your chance of having hypertension. So maintaining a healthy weight. So ways of maintaining a healthy weight includes eating a healthy diet, like we said, exercising regularly, and cutting down on your salt intake and your fat intake will all help you to maintain a regular and maintain an adequate weight. So it's also important. The next one is to avoid smoking or cessation of smoking. So we know that it takes time for someone to cease smoking. So avoid smoking includes like not trying to smoke. If you've not started smoking, it's important that you know that you do not need to start smoking at all. And you should also stay away from secondhand smokes. And if you were already smoking, you should take steps to cease, like stop smoking. You can contact your healthcare provider or enroll into a program for cessation of smoking. You can start by using the nicotine patch, chewing the nicotine gums, then as gradually you progress to ceasing the use of tobacco and all that. That is very important. And limiting your alcohol intake or not drinking at all, because alcohol has effect on blood pressure, and the little amount and contains high causes of glucose too. So the little or no alcohol you take is very important. And you should always monitor your blood pressure. And as mentioned on the earlier slide too, just monitoring your blood pressure constantly and taking your prescribed medication is very, very important too. So this helps you know if your blood pressure is the medications prescribed or ordered for you is not working to decrease your blood pressure, or your blood pressure is consistently high. This one will help you to like relay that information to your healthcare provider to adjust your medication as to adjust your medication accordingly for you. So it's also important to just monitor your blood pressure very, very adequately, at least twice a day, as soon as you wake up in the morning and before you go to bed. Is very important. So with this slide, on this slide, we're going to talk about comorbidities of hypertension. And this include heart failures, sexual or rectal dysfunction, vision loss. So with a consistent pressure in the heart, the blood vessels just pump the blood out. It weakens the heart vessels and the blood vessels, which can lead to heart failure. With sexual and rectal dysfunction, which is mostly seen in males, is something that's very common with males who have high blood pressure. And vision loss, this can, like the pressure in your eye, can cause some of the vessels in the eyes to rupture, and it can lead to vision loss. So with stroke. So with the stroke, mostly it happens because we know that there's so much the pressure buildup in the brain can cause a rupture of the vessels in the brain that can cause bleeding in the brain, and that can lead to stroke. So we have kidney disease, that is hyperperfusion of the kidneys, can also occur as a result of hypoperfusion of the kidneys, can result as a result of blood pressure because they are not getting adequate blood flow, and kidney failure resulting from the kidney diseases, and memory loss, which can all be as a result of the stroke and blood pressure, high blood pressure. So blood pressure comes with a lot more comorbidities. That is why it's always important that we keep an eye on, just keep on checking our blood pressure at least daily, once a day, and reporting the findings to our care provider. Sometimes a high blood pressure doesn't necessarily mean it's supposed to be above 140. The systolic blood pressure has to be above 140. But if you notice an increase like 10 or more from your regular normal blood pressure, I think it is something you need to bring it up with your provider. I think it is significant enough to bring it to the attention of your provider so that the adequate measures can be taken. So ways that we can decrease our blood pressure: increase our diet, decrease eating a good healthy diet, having regular exercises, and making sure that our prescribed medications that we were given are taken as ordered. So our next slide has different kinds of references where we can get more information about high blood pressure, the comorbidities, the treatment, and when and where to seek help. So we have all the references you want to watch here. There is video on the American Heart Association website, which gives you very good information about high blood pressure, and the Mayo Clinic also provides a very good information about high blood pressure, so as also the Center for Disease Control and Prevention. Thank you very much for watching this video.